All right, I'm going to go ahead and kick us off. Good morning, everyone. Thank you for jumping on the December 2025 quarterly meeting. I'm Claire Healy. I put my info in the chat. I'm a consultant for workforce development and strategy at Chicago Medicine. I'm also part of the CHWC steering committee, so I'm kicking us off. We're passing it over to April. Today's meeting will be recorded, so we're recording right now. Both the recording and the slides will be available on the website tomorrow or later this week. And it'll also be sent out in an email to everyone that registered. So you will be able to access everything at a later date. But kind of ground us in what CHWC is, the Chicagoland Healthcare Workforce Collaborative. We unite employer and industry partners to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. This is really led by three strategic pillars, the first being local and targeted hiring, the second being education and training, and then the third being retention and career pathways. This is an employer-led sector partnership, many of those employers being listed on this page that you'll see here, in addition to 20 plus strategic partners. So it's really led by partners and collaborative, as it says in the name, to really lead this work and the strategic planning that happens and will be going on through 2029, from what I understand. And with that, I will pass it on over to April.
Thank you, Claire. Good morning, everybody. Thanks so much for joining on this snowy December morning, cold December morning. I'm glad we are virtual today. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative. Here is our agenda for the day. So first, we're going to take a moment to reflect on the year. I will go over some of our accomplishments from CHWC in 2025, and we will jump right into some mini breakout rooms. So get ready for that. That's just a few minutes away. You'll have an opportunity to meet someone new or connect with someone you might not have seen in a little while to talk about your workforce accomplishments and what you have planned for the coming year. Then we will go into our Respiratory Therapy Workforce Summit debrief. This is a large event that we hosted on November 4th, the first of its kind. And we have a lot of work to coming out of that into 2026. So I've invited Dana Evans, who is part of our planning committee, to give that debrief. She's the regional respiratory director at Advocate and also the president of the American Association of Respiratory Care. Then we are going to talk about a grant-funded project that CHWC is working on in partnership with Malcolm X Community College, as well as the Chicagoland Workforce Funder Alliance. Through this project, Malcolm X has been able to hire some student ambassadors who are supporting their peers in navigating different healthcare programs and being successful in healthcare programs at the college. So I'm excited to invite Darwin Archie Pettis here, who is the Executive Director of Career and Workforce Development for Malcolm X. And I think one of the most exciting parts about this morning is we're going to hear directly from those student ambassadors. So Tony Hemphill and Lionel Riddle are student ambassadors at Malcolm X, and they will be joining us to tell us about the initiatives that they've been working on. And they also have some ideas, some advice, some asks on how employers could better support Malcolm X students and how employers could get more involved with their initiatives. So please stay tuned for that. Then I have a couple of discussion questions around 2026 planning that I would love your input on. And then we'll move into community announcements. We'll kick those off with updates and announcements from our sister table, the Public Health Workforce Collaborative, as well as our combined committee, the Youth Pathways Committee. But then if you have anything to share, events coming up, initiatives that you'd like to partner with others on, please feel free to announce those at the end of the meeting during community announcements. So let's talk about what CHWC has been up to and how we're doing. This is a vision statement that the steering committee came up with at the end of 2023 to guide our growth over the next 5 years. They envisioned CHWC as a healthcare workforce development think tank led by exceptional healthcare leaders with experience in health equity, workforce development, community engagement, and diversity, equity, and inclusion. And that CHWC is recognized locally and nationally as an exemplary model of peer learning and collective problem solving. So that's really what we've been trying to hone in on and strengthen is the peer learning um, piece of what CHWC does. We've done a lot of peer learning events and also made efforts to bring healthcare leaders together to have discussions and do collective problem solving um, around specific issues that affect the entire ecosystem that none of us can really tackle on our own. So I'm happy to report that we've done a lot of that this year. We hosted 4 virtual learning events at the beginning of the year. Those featured not only Chicagoland workforce projects to share best practices, but also highlighted some programs from elsewhere around the nation to learn from. We hosted an in-person employer peer learning event that brought together small teams from 7 different employers to sit down and learn from each other in sort of a round robin speed peer learning event that was very well received. And then we hosted an in-person event on healthcare apprenticeships in October. This was voted the number 1 topic that people were interested in learning about at our December meeting last year. So we hosted an in-person event about that this year in October and highlighted medical assistant apprenticeships. So later today, I'll be curious to hear what you want to learn about next year. And then finally, we hosted the Chicagoland Respiratory Therapy Workforce Summit with over 100 respiratory therapy leaders in attendance. This is the largest event that CHWC has hosted so far. It came out of an idea from our steering committee at the end of last year with the thought that it'd be great if we could get together all the right people in the room to talk about one particular talent area where we are having a lot of challenges. And we decided to tackle respiratory therapy first. So I'm excited to share more about that with you in a few minutes. Then on impact and collaboration, as many of you know, we were part of the Good Jobs Challenge grant, federal grant that had 4 different sectors in Chicago we're a part of. Through that grant, we were able to build a nursing assistant training hub with 5 different employers and 4 different training providers. We had 211 individuals complete CNA training, and at least 121 of them secured jobs. I actually think that number is higher. We also had 9 individuals from Rush start on their pathway to become RNs in the Associate's Degree of Nursing program at Malcolm X. And I'm pleased to share that Rush has been able to find support for those students to continue the rest of their degree. So they're still working towards their Associate's Degree of Nursing. We focused on the Good Jobs Challenge grant at our September quarterly meeting. I am compiling a report. I think it's really important to codify the learnings that we have from these collaborative grant efforts. There are still some loose ends with the Good Jobs Challenge, so we're waiting for some of that to be completed. But a report is forthcoming, and I'll be sure to share that with all of you when it's ready. We strengthened collaboration with Malcolm X through this initiative to support Black male participation and success in health career pathways. You'll hear more about that today. And we've also supported some career navigation projects. We supported Women Employed's research project called Navigating the Maze. If you have not had an opportunity to check that out yet, I highly suggest that you do. I'm going to drop the link in the chat. This provides many insights on how women have advanced through their careers in healthcare, both the drivers of advancement and success, as well as barriers. And there are many recommendations for all different types of stakeholders to make career advancement more accessible for more women in that report. So we supported that research. We have also supported a couple of projects with Health and Medicine Policy Research Group and Innovation Nexus to build career pathway resources and maps. There's a little bit of a delay with those, but I'm pleased to report that the print version that Health and Medicine Policy Research Group has spearheaded will be completed likely by the end of January. So I will be sharing that with you and updating you on that as well. So let's just take a second to applaud ourselves. Congratulations to all of you for accomplishing so much in CHWC this year. Are there any questions about these or anything I missed? Okay. Well, with that, I told you this was happening right away. Um, I want to give you all an opportunity to chat with each other, maybe meet someone new, catch up with someone you haven't seen in a while. So we are going to go into breakout rooms. I know this isn't something that is easy to do when we are meeting virtually. So I want to give us the opportunity to connect even though we are meeting virtually. So we're about to open breakout rooms. Just introduce yourselves. You should be with just 2 or 3 people. What are you currently working on to support the healthcare workforce? What are you focused on with your organization right now? And what partnerships would you like to build or strengthen in 2026? So I'm about to launch the breakout rooms. I put the questions in the chat. I will be here in the main room, so if you have any problems, feel free to, just shout me out. I can put you in a new room or help you out. And we will come back at 8:55. Or hands or by waving. Who met somebody new today?
I did.
All right. Okay. Who connected with someone you hadn't seen in a while?
I did.
Everyone.
All right. All right. Who talked to someone that you plan on following up with? All right. Does anyone want to share something that came out of your rooms? Any good conversations, good point of connection? 1 or 2 shares.
Okay, I'll go. No one's
Hey.
speaking. So, hi everyone. It's Sandra from OAI. So, yes, Tara was in my team, and so was Bridget. Bridget, I just met. Tara, I know. And we talked about the work we've been doing in the healthcare space, and the work they're both doing together with so Tara is talking about all this stuff they're doing to prep the incumbent workers for the next level. And OAI, got the apprenticeship grant that actually was written as part of, with contribution from April and her team. And that grant actually provides opportunities to support people on the pathway to RN. The whole idea is to, keep upskilling so that way the wages can be better. So we talked at all 3 of us talked about that and how we might, do some things together again. Because women employed on OAI, we've done a whole bunch of work in the past. So different, a lot of relationships have been established, and so therefore we can do more in the future was the idea.
Awesome. Congratulations on getting that grant, Sandra. I'm very excited about the idea of having an RN apprenticeship, registered apprenticeship in our region. So please let us know, what you need from the collaborative, or if you'd like to host an event around this or something.
Yes. So what we're planning, so is a new one. We were approved for 2. So one is operational now, is the OSS one. The second one is the RN. So we had to build that out and submit to USDOL. They just approved it. So now we can have a meeting with all of you so we can revisit our initial plan and how it will actually be implemented. So for sure, we're going to have a meeting. Thank you.
Congrats. Awesome. Anybody else want to share something that came out of their breakout rooms?
I
Hi, this
I
is
think
Brandon.
Leslie.
Oh,
Go
good.
ahead.
This is Brandon from Rush Education Career Hub. I met Marcos and Annette from ISAC, and I forget Marcos' organization, but it works with SAFE or Second Chance or Fair Chance Hiring programs, and so that was really helpful, especially at looking at some of our pipeline programs for in the community for. Like for example, EMTs, there's some waivers as we know with IDPHS, so it's good to make a connection. And then ISAC, so wonderful. So it's good to get another connect through ISAC. So that was great for me. Thank you.
Good to hear. I love hearing about all these great connections. All righty, moving along. It's my pleasure to introduce Dana Evans, who's the Regional Respiratory Director at Advocate and also the President of the American Association of Respiratory Care, to tell us about the Chicagoland Respiratory Therapy Workforce Summit we hosted. Take it away, Dana.
Good morning. Good morning. Thank you, April. Thank you for having me this morning. I'm really excited about the work that's been happening around respiratory therapy workforce in the Chicagoland area and the amazing collaboration we've seen in recent weeks and months, really trying to tackle this problem. So thank you to April for bringing together a steering group to look at how we might begin to tackle this. And the purpose of our having this summit and the work groups associated with it that we'll talk about in just a minute is really to develop an action plan and working groups that will increase the number of respiratory therapists in our region. We know there's a national shortage of respiratory therapists, and the Chicagoland area is uniquely impacted just because of the size, our population size. So we wanted to increase the shared understanding of the causes and impacts of the shortage, as well as co-design solutions with respiratory therapy department leaders, HR leaders, talent acquisition specialists, workforce development specialists, program directors, both at the community college and at Rush at the master's level, and other stakeholders to really kind of hone in on how can we get more respiratory therapy students enrolled in school. How can we create more opportunity for clinical practice, training opportunity? And once they become a respiratory therapist, how do we retain them in the profession and not lose them through other opportunities and create opportunities for career advancement and autonomy at the bedside? Change the slide, please. Thank you. So just a quick level set here. As I mentioned, respiratory therapy workforce shortage is a national issue. Now, the Bureau of Labor Statistics predicts about a 13% increase in demand for respiratory therapists through 2033. That's been steady every time they release data. It's somewhere between 12 and 15% demand increase over the following 10 years. The vast majority of respiratory therapy leaders in the United States report a shortage within their own departments, and about 84% are predicting an ongoing shortage of respiratory therapists. And we know that we have a lot of retirements coming as well, right? We have a lot of respiratory therapists approaching that age. So we're anticipating within the next 10 years to have a shortfall of about 6,500 respiratory therapists. I think that could be conservative, actually, if action isn't taken. But so lots of things going on here where we need more in the pipeline and we need to keep more at the bedside. Part of the challenge we have here is a reduction in enrollment in respiratory therapy programs. So we've seen a pretty significant reduction in the total of applications over the last decade or so since 2011. And only about 9% of programs are reporting that they're at full capacity, all the seats they have. So we have a lot of respiratory therapy programs in Chicago, Cook and Collier counties. But they're not at capacity. In fact, only a couple of them are at full capacity, which is problematic for us. You might think that COVID shined a light on respiratory therapy and really made people more aware of who and what it is. What we've actually seen is quite the opposite. We're starting to rebound from it, but we did see a whole run of high school juniors and seniors who were declining to be respiratory therapists because they did not want to be on the front lines of a respiratory pandemic. So some of our even full programs reported some declinations associated with that understandable concern about personal safety. So really, that's the national data. That's what we're seeing on the national stage. But we wanted to really understand what was truly happening in Cook County. I think a lot of, and the collar counties, I think most of you probably know that when we post open positions, we don't post all of our open positions, right? So maybe you post a day shift and a night shift, but you certainly wouldn't post 15 or 16 if that's what you had. So working with April, the group did a survey of respiratory therapy department leaders in the area, and about 46% of them responded, indicating a real, true vacancy in those hospitals of 176 respiratory therapists. If you extrapolate that out to the entire region, assuming generalizability, that's about 400 open positions in our area alone, excluding home health, which is challenged in its own ways and certainly has a large number of vacancies. Contrast that with only 63 graduates in our area last year. So clearly, supply is not meeting demand. So what are we going to do about it? Right? This is a huge problem. Our patients do need respiratory therapists. So delighted to bring together this really incredible group of very passionate and engaged individuals to start to talk about the issues. We had didactic education panel presentations, great group discussion, and these working sessions you're seeing down in the lower right-hand side to really get at what are we going to do about it, and how can each of us take individual responsibility to increase not only visibility, but retention of respiratory therapists in our own community. So it was just a really great day. Next slide. So out of all of that work and distilling all of the information, discussions, and just incredible ideas that came out of it, we've come up with 3 pillars to focus on: outreach, training, and retention and advancement. Under the outreach pillar, we're going to really focus on ensuring people know what respiratory therapy is. You can't be something you've never heard of, right? So we want to focus particularly on middle and high schoolers, really showcasing and highlighting what respiratory therapy is and the many varied career pathways that respiratory therapists can have. From the training perspective, we're going to focus on coordinating, leveraging resources to ensure our students have the academic and financial support to enter RT programs, as well as focusing on the training and development of faculty. Another huge area of challenge for us, not only in our region, but nationally, is having academically prepared respiratory therapists who are qualified to teach respiratory therapy. Obviously, you have to have a baccalaureate degree to teach at the associate level. If you want to teach at Rush, you have to have a minimum of a master's or a PhD as they're a master's program. And then we want to focus on keeping them in the profession once they enter it. That's the retention and advancement pillar. And what really came out of that was a desire to create systems that support evidence-based respiratory therapy autonomy and decision-making. And what that might look like is RT-driven protocols at the bedside to support patient care, and really ensuring that our RT leaders and our cultures are creating a psychologically safe work environment so they feel appreciated and really encouraged to grow and thrive in that space. The respiratory therapy educators that joined us, and we had representation from every program in the area, were very excited and really delighted to be connecting with each other in a way that they don't typically do. So they are motivated and have asked to have continuing meetings with them as a group to think about ways they can be creative. So for example, several of them recognize they all try to do clinical on Wednesdays. Well, you can't take students from every school on a Wednesday at a hospital. It's just difficult to support that. So, how can we be creative and have you do it on Tuesday and you do it on Thursday, et cetera, and really working together to try to meet that training demand at the bedside. So that will happen. In addition to that, we've also launched 5 working groups, identifying co-chairs and putting together teams that will tackle the objectives under those 3 pillars you saw. The co-chairs will lead those groups, but we'll come back and meet with the steering committee quarterly, or, of course, we'll be available to answer questions more regularly if they need that, to report on progress, to answer questions, to make sure we're really moving the needle on this and continuing to support the efforts. And then the Chicago Healthcare Workforce Collaborative will support this group through 2026 as we're getting these off the ground and lifting them up. And then we'll start looking at long-term homes for this work. I suspect the Illinois Society for Respiratory Care will be one of the big ones that'll take a lot of this work on, and we'll then be able to, sort of take those learnings and teachings down to everywhere else in the state as well. So we're excited about that.
Thank you
And I
so
think
much,
is that the
Dana.
last one? Yes,
That
yes.
is, yeah.
I'm just going to tell you, just as an aside, you mentioned I'm the president of the AARC. One of the things that I really hope to be able to do is to get other areas, especially large metropolitan areas like Chicago, to replicate this work. So I think this will be not only frame shifting for Chicago, but potentially for the profession as a whole.
Thank you so much for joining us, Dana, to
Yeah.
give this debrief. I want to open up the floor to questions about this summit and about the future work. I'll also mention that, well, I think it's important that CHWC continue to support, the convening that's happened around respiratory care, and to support that work into the future. That's where the rubber hits the road and the real impact begins. I'm also interested in CHWC looking to replicate our success with a different area, a different talent area where we might also be facing some shortages, and it would be beneficial to get educators and hospital leaders together in a similar way. So questions or feedback? Anyone have an idea about what we should do next?
Yeah, this is Brandon again from REACH, or Rush Educate Career Hub. Thank you for that. I talked about going to that symposium, but it said RT leaders, and I'm not an RT leader, so thank you for the debrief. Two things. So, one, I just talked to a parent the other night during our uh, session that was from mixed for students and community members that was interested in doing a career change to RT. So I would recommend maybe, adding that to your target group. I know you said high school students, but to maybe career changers. They're currently an educator at a charter school and want to do something in healthcare relatively quickly, so like a 2-year degree or less. And then secondly, I'm looking at the prerequisites for the Malcolm X program. And so the statistics and English 101 and intro to anatomy, I'm working with CPS or other school districts as well, and helping high school students do dual enrollment or dual credit in those courses so they can get a head start while they're in high school, introduction to the career, and not have to spend maybe a semester just to meet the prereqs to get in. They can get that taken care of in high school. Thank you.
That's good feedback. I will tell you, Malcolm X is one of the few programs that has a waiting list. They're full, full, full.
Yeah, thank you for those ideas, Brandon. If you or if anyone else on this call wants to join one of these working groups, you are welcome. We've been sending the information out to everyone who attended the event, but there's certainly a role for HR leaders, workforce development leaders, funders, advocates, everyone in this room right now to participate. So please let me know if you would like to join one of the working groups, or if you have a colleague who would like to join. Any other questions or comments? I am curious if I can ask a question to the group for all of or Tony, you go ahead.
Hi, good morning. I had, well, just a suggestion, or I don't know if anyone else. Here at Chicago State, we have a program that's called dual enrollment, where we recruit students that are juniors and seniors from the high school, and they take college courses here. that helps them academically. And I know they do have, some of the high schools do have a health career curriculum and then they take classes. So I don't know if anyone has looked into that to get them straight from high school. Because I've had students who have come to me for the CNA program and they excel because they get a lot of that information in class. And those classes are taught by the experts. So they're taught by the nurses. So I don't know if anybody has looked into that as far as recruitment.
I think that's a great suggestion, Tony, and I suspect that'll be one of the things we look at in that working group. I know CPS does a lot of work around this in particular, so hopefully we can leverage some of that. And a lot of our high schools have STEM courses or health education courses that we could hopefully get our toe in a little bit, because a lot of those programs also don't mention respiratory therapy either. Mhm.
Well, and I know that, Malcolm X College is involved with dual enrollment programs. One of the challenges, though, with Malcolm X and with some of the other community colleges in our region is being able to fill a clinical rotation sites for all of their students, and also to recruit enough faculty, recruit enough adjunct faculty to increase enrollment, to actually enroll at the capacity that they are accredited for. So that's something that the educators will be talking about when we reconvene with that particular group. But it's something to think about as employers, if there are ways for you to open up more clinical sites, to allow some of your respiratory therapists to also become adjunct faculty. Not suggesting anything specific because that group hasn't come up with any or hasn't come out with any specific recommendations, but those are the types of things we're talking about. How can we make sure that a CPS student can go to Malcolm X and go through the respiratory therapy program when there's now a wait list for that program?
Yeah, I
And
think one
now,
of the primary barriers we see, and not Malcolm X specifically, just in general, is particularly with COVID, we've seen bedside respiratory therapist salaries rise, probably appropriately so, but we have not seen the academic salaries rise in concert. So very commonly, when we're talking about folks who wish to transition to academia, we're asking them to take a financial cut, and many of them are just unwilling to do that or cannot do that. So this is a big challenge that is multifaceted, as you can imagine.
yeah, now I was going to mention too, and I put the link in the chat for those who are interested. And talking with the parent the other night and looking at this list of accredited programs, there aren't that many in the Chicagoland area. Looks like Malcolm X and I think was College DuPage, one of our collar counties, but outside of that, they're all, downstate pretty much, looking at this list. And then Rush is a master's degree program, so that's even more challenging.
So we work closely with the College of DuPage, Moraine Valley, Triton, Kankakee, Augustine, Lewis, Rush. There are Elgin just opened a program. So there are a good number in the Chicagoland area. And, I'm one of those people that will tell you I'm not a proponent of adding more programs. I'm a proponent of filling the seats in the programs that we have. Right? It's challenging when you're at 50% enrollment to argue to keep a program. And so what we sometimes see is programs close because of because they just aren't financially viable, right? You got to fill the seats. So I think Triton is another Triton and Malcolm X are the only two that have been at capacity. All the others have lots of space to add students. So that's really what we want to focus on now, is continuing to fill the programs that we currently have. I don't disagree with you. I think at some point we have to talk about adding programs, but from my perspective, I think it's about filling the seats for the programs we already have so we can make sure they remain fiscally viable and we don't lose those programs. As a profession, we went through about a 10-year run where programs were closing, and we don't want to see that in Chicago. Triton was actually one of them that just reopened about a year ago. So we're excited to have them back in the mix, but we lost them for that purpose, for that reason about a decade ago.
Shonda?
I have a question, like for this whole process. So like to your point, Dana, where the programs are not full versus programs that are full, do you think that the opportunity presents itself where if a person, I know the distance is going to be a thing, but again, like if Malcolm X does have a waiting list or Triton does have a waiting list, the programs that have capacity where if your local community college, whatever you have it, like it's at capacity where they can go to said other place for the same amount that they would go to their local school. Kind of how like with the 2-year college where your school doesn't offer a program, you can go out of district to someplace else.
I think that's an incredible comment, Shonda, and I'm really hoping that our faculty start to talk about that. You know, I think Malcolm X in particular would love to be able to welcome more students. Their challenge is getting faculty to be able to do that. But to your point, I think being able to share the wealth, so to speak, is important, and it's good not only for the individual because who wants to wait another year and hope that they get in? Likely that they'll just change, right? They'll do something else, particularly if they're a really motivated second careerist. So I think that that's a really important conversation. I'm really hoping that our faculty members start having those discussions when they meet.
And related to that, and I'm showing my age here, but in the 90s, I used to be the dean of distance learning for city colleges. We had a program called ILCO that was a state program. So essentially, we shared open seats in our online courses across the 49 college districts, and everybody got a piece of the pie. So if they took the course, say at Triton, but they were a City College student, Triton got some money and City College got some money. Triton got most of it because they offered the course, but City College got a little piece of the money too. So we have a model that we use very successfully, similar to that for sharing seats, if you will, equitably, if you will.
Yeah, thank you for that. I think the biggest challenge, so I agree. I think that for the didactic courses, that makes a lot of sense. Probably the biggest challenge that our faculty face is having the ratio needed for clinical training as well as lab training. So there's a required ratio for that. So making sure you have the number of faculty to support that hands-on laboratory stuff that just can't be done as a distance learning opportunity, and then ensuring there are enough clinical seats to support them. So I think those are the two areas we'll primarily focus on, but I do think there's merit, particularly with prerequisites and some of those courses that could be done in a distance format. And I've seen that done. I'm from Missouri. We used to do that at the University of Missouri with some of our satellite campuses. We would do some of our didactic coursework virtually, and it worked nicely.
Oh, just to be clear, I wasn't talking about the distance learning. I was trying to emphasize the sharing of the revenue
Yeah,
and sharing of the seats. Yeah, I know distance learning
that's
was
clever.
clinical,
Clever.
but yeah, the sharing of the seats and revenue.
Great ideas. Brandon, I'll definitely follow up with you about joining one of these working groups. Thank you so much, Dana, for coming
Yeah.
and presenting, and thank you for your leadership in getting this event off the ground and the action plan. Very much appreciated.
I think I would echo that back to you. And thank you for having me. I'm excited about this. I could probably talk about this all day. I won't make you listen to me, but I hope you have a wonderful rest of your day. And I look forward to sharing some hopefully very successful updates from this program in the future.
Definitely. Yes. Thank you, Dana. With that, I'm going to shift gears to talk about a grant-funded project called Advancing Equitable Career Pathways. This is a project funded by the National Fund for Workforce Solutions, which is a national organization focused on workforce development. They wanted to tackle the issue that people of color are underrepresented in many career pathways that lead to middle and high wage jobs. And community colleges and employers might uphold these drivers of inequity and are places where we might be able to design and test strategies to change this scenario. So they put together this grant award and chose 4 awardees. So we are one of 4 cities who have received the grant. We are obviously the Chicago team, but Cleveland, Springfield, Massachusetts, and Syracuse, New York are also teams. The 4 of us will actually get together in Syracuse in February to share with each other what we've been working on. It is a 28-month project. So we are, I know you probably can't see the timeline at the bottom very well, but we are at the star here. We are about 3/4 of the way through. We have gone through our design phase, and we had a couple of CHWC employer representatives at our design sprint from Ascension and Northwestern Medicine. And we have now piloted our strategy, and we are observing how it's going. So as I mentioned, this is a partnership between the Chicagoland Healthcare Workforce Collaborative, Malcolm X College, and the Chicagoland Workforce Funder Alliance. And with that, I want to pass it over to Darwin Archipettis from Malcolm X to share about our goal and our strategies, and to introduce our ambassadors. Take it away, Darwin.
Well, hello everyone, and welcome. My name is Darwin Archipettis. I'm the Executive Director of Career and Workforce Development here at Malcolm X College. I'm also joined here with AD Corey Young. There was some trouble getting onto the Zoom, so but also I have one of our ambassadors, Tony, here, and Lionel. Are you on here as well? We can't hear you. Okay, well, he's here. He's on our on another laptop, but they are our two. Was that him? Okay, sorry. There's a little trouble right now with the internet here, but we are putting on a peer ambassador program here at Malcolm X College as a to address the issue that is happening with people of men of color being in the allied health or health sciences programs. And so we're going to go over a couple of the strategies that we went to fulfill this goal, and with designing the peer ambassadors program, and some of the things that we've already done to that's already helped push for success of our enrollment, and just the confidence of our students into joining these different departments. So are we going? Yep, next page. So we have our student voices that are going to be very key. And so most of the ideas are coming straight and directly from our student body, led by our student ambassadors, Lionel and Tony. And so far, we already have done focus groups. We've had ambassadors meet with our health sciences directors and become the building blocks to really make a significant change into our departments. I love them so much. They have no fear going into a room. Like, I could only imagine being in college, going to a room full of directors and associate deans and just saying exactly what needs to be done. And they did just that. And through that, they've already come up with a great program, which is scrubbed in for success. And so as you see on the picture with the dental hygiene, they're going to do a whole campaign where they're making sure that students understand and know what the different scrubs mean throughout the campus, so it can foster conversation. It's a lot easier to talk about programs when you see people see different student scrubs and know exactly what those mean, and so that you have an idea of all the different programs that exist here, and also have understanding and defined understanding and knowing what it takes to get there. Through that, we also have done 2 more big events, and one is a pre-game violence prevention panel, in which we worked with U Chicago and violence prevention youth program, in which our team has done a panel where they were able to influence students that are not yet here, but now are looking to come here for. And we worked with the MA program, medical assistant, and also the PTA program, physical therapy assistant program. But we're going to do more of these programs in the spring, where we're going to highlight other programs that we have here. But this is also coming off as, student interest. We have also met with the IM program, which is a male mentor program, and we've done an open house in which we invited all the male students throughout our campus, so we can get more of their ideas and understanding of what their needs are specifically. And so it's not just coming from the top to the bottom and thinking that and assuming that we know everything that they need to get them there. If that was true, it would already be a thing. So we had our ambassadors lead this program through and really help and understand our students a lot more. We came up with a couple topics and we allowed them to do breakout and come up with ideas of what their needs are, and then they would share it out throughout and open up dialogue for them to expand on those ideas. All right, we go to the next page. All right, so ways employers can better support our students, and this is coming straight from our students, is look to get mentors from beginning stages of employment, 2 to 5 years, instead of ones that have been there for a while, just because it's a lot more relatable, and we usually already get those employers already, but getting the ones that's just getting started and really starting to understand so that they can help them get on board and know what's the outlook's right in front of them instead of in the distant future. Also, they said that with the summer, they are kind of losing some knowledge and understanding, and so there's not a lot of internship programs that are directly into in the nursing or some of the other health sciences. So having a summer intern program where they actually get to work with the nursing and do some rotation so that they can maintain their knowledge instead of losing is a real big thing. But then also some of the hospitals and employers creating incentives that's going to attract these type of students. And so obviously it's going to have to come and bring focus groups and understanding of what those incentives look like. But there has to be some type of campaign to really draw in more students. And so that is mostly what we have right now. But we are.
If I don't know if Lionel, if we've solved a sound issue, but I'd love for Lionel and Tony to just introduce themselves as well.
Okay, I'm Lionel Riddle. I am a student ambassador in the nursing program, and I'm here for health science and nursing. And I'm a first semester student.
Hi, my name is Tony Hunfield. I'm also in the nursing program, first semester, almost finished with the semester. Um, and I'm here also as a student ambassador for the health science department.
Thank you both so much for joining. I had the pleasure of going to an all-college event at Malcolm X and hearing both these gentlemen speak on a panel, and it was incredible to hear what you've been able to accomplish and all the insights that you have into how you can create a better, more supportive environment for your peers. Do either of you want to add anything to what Darwin said about what you've already been working on, or what you think employers could be doing?
Well, I'm Lionel. I can go. Let me see. The conversation we had yesterday that I wrote a couple of ideas down. Um, Again, the summer internship. I think a college fair for actually jobs that right out of that you getting your degree, you should be able to apply for, because sometimes we apply for jobs that we don't have the experience. So having a job fair that actually jobs that we can work based on the experience we have, based on having no experience actually on the job, that will be helpful, because a lot of times we apply for jobs after fresh out of the program, and we don't fit the mode of that job. So basically doing all these job applications and it's going nowhere. So if possible, some type of job fair for oncoming nursing students turned nurses would be a help, I think.
And Lionel, Tony, I think you mentioned like there are specific types of people that you'd really love to connect with at job fairs and other events. Can you tell me more about that?
I wanted to add to what Lionel said. I would say like bring I would say like also have us to you know how you need experience for a job, like hospitals, like good hospitals would allow, they would want students to have, or nursing students or whatever profession you're going into in the healthcare, they will want you to have like some type of experience, like if it's a real good hospital or something. So I would say add programs for students like while they're in school, like more intern opportunities, so we can gain the experience that we need to get into the hospitals that we want to work at.
For me, far as what we want to hear from, I think orientation, when we have our orientation for the nursing program, I think it would be helpful to actually have a conversation with first year nursing that's in the profession. On top of hearing from our professors and the department, also hear from people that either came out of Malcolm X College or any other college that are in their first year on their career path, that we can actually ask questions from them and have them speak. I think that is more helpful than hearing about a department that we're not even familiar with. Have somebody that can kind of break it down to us in a term that we understand, and see that it's possible for us to complete and actually be successful in it.
And Shonda mentioned in the chat, at Malcolm X College, is CNA included in the program, and can it be added to the program sooner so the RN students can get employment sooner? Do either of you have any insight on that?
Yes. We do have it's called BNA, basic nursing. And so you can get the BNA, go through the BNA program first. We also have an LPN program that also bridges as well. So we do have those opportunities for our students so that they can gain experience and get employment sooner. Also, I wasn't at the end of this meeting, but yesterday, but thanks to our director, Rhonda Hardiman, right after they do their pinning ceremony, there is a job fair that has all that's directed towards hiring our students right away without all the extra experience, and just knowing that using our career center to make sure that we are pushing and letting through their resumes, letting them know that their experience through their clinical rotations and everything, those also count. So I would have we've talked about it a little bit, but just to push further on, we do have those opportunities at working with them, and our CNA program, our LPN programs, our RN programs, like they can all intertwine. There's multiple ways to go and enter into the RN program.
Yeah, I was going to mention, I put in the chat, and my daughter did this also. It's my understanding that intro to nursing course, the 101 or whatever it's called, the first nursing fund, qualifies you to be a CNA in Illinois. And I know my daughter did that her first semester at Rush nursing program. So that, I don't know if Malcolm X, if their curriculum is structured differently, but that's my understanding that the intro to nursing course for nursing qualifies you. And I put the link in the chat for people to fact check me. Thanks.
All right.
And I saw SVP Walker go off mute. Feel free to jump in.
Yep.
I also, following up on that, I was curious with both Tony and Lionel. I think have either of you worked as a CNA while doing the nursing curriculum? And is that something you think is reasonable?
I currently work as a CNA full time, and I'm in the nursing program. It's kind of like crazy because like you don't really get no sleep at all. Like it's crazy. It's like 1 week could be it's like a roller coaster. That's how I could compare it. Like 1 week could be okay, and 1 week won't. So it depends. I think as the program progresses, though, I'm gonna have to cut down on hours like a lot because it's gonna be impossible working so much and studying.
I just want to say that, sorry, Ron, go ahead.
No, I wanted to talk to, I think Mr. Taylor. I raised the question around the CNA course. So it is actually a distinct course from the nursing ADN program because CNA is required as part of the admissions requirement for our ADN nursing program. So I want to make that clarifier. So We do offer the program, the CNA program by itself, and it is a prereq to get into the ADN program. But in Nursing 101, you do not get a CNA because you would have already had to have it to be admitted in the first place.
I was just gonna say exactly what Ray said. That is one thing that made us OAI to go in that career pathway, because you can actually work as a CNA while going to school as an LPN or an RON. And that is not to be taken for granted because you can literally have an MBA and don't have a job. Going through this pathway guarantees you a job. And you could also be I like the whole career pathway, ability to work up until LPN. As an LPN, you can start earning like livable wages, right? So I like that it's built in somehow along the way before you become an RN.
Thanks, Sandra. And Roy, I wonder if I could call on you to address Christy's question in the chat. Does the federal government's assault on DEI programs or those focused on a specific racial or gender demographic pose any threat to a compelling program like this?
So at the moment, it does not, because we don't necessarily do race-based admissions to begin with. We are open and access institutions, so we don't make programmatic decisions based on that. And because of our diversity, it's never really been a threat for us, to be quite honest with you. Now, that being said, recent announcements from the Department of Education as far as doctoral and advanced degree programs they will no longer fund is a concern for us. I think that we all need to be kind of keep our eyes on, because for us, that's going to exacerbate the faculty shortage that we currently face right now, which I spoke in our earlier breakout meeting to one of our colleagues, was one of the things we're working on. It's something that we're a little concerned about, because we need more faculty to teach in our programs, not just nursing, but respiratory therapy, surgical technology, the whole nine. So as of right now, the attack on DEI not necessarily has hurt us. And because we did not do race-based admissions to begin with, no concerns at the moment. But let's face it, I mean, every day it's a different story.
Yeah, and you know what? The policies that they are putting forward, right, they're sometimes covert and sometimes overt. For instance, saying that nursing is no longer a profession. Like, seriously, how profession can you get? So, and then when you look at that policy of not funding nothing, of no longer calling it a profession, it's tied to the money as well. So what does that mean? That means that people that are in that pool are targeted. When you look at the population that actually do that program, is people, a bunch of minority people, women, people of color and all that. They're the ones that are in that pool. So for me, that is the covert way of attacking that whole ecosystem.
Yes, a lot we could talk about there. We do have to move on to our last few agenda items, but I want to thank Lionel and Tony so much for joining us today. Is there anything else you'd like to share with a room full of employers and other healthcare workforce stakeholders?
For me, I would just say be more open to giving us opportunities as being at the beginning of our career, more more clear ways on how to get into, like, say, the hospitals that are harder for oncoming students to graduating out of the program to get in. Just make it a little bit more easier for us. Far as what you're looking for, be empathetic that we are at the beginning, we are willing to learn, we are open to being trained on the job. We just have to be given the opportunity.
Thank you so much, Lionel. Tony, you want to add anything? You're on mute.
I wanted to add, like, pretty much what's going on in the economy and stuff in the world. Like, I feel like we should be educated on what's like happening if we're going to school for these things, we should be told like what's gonna happen in the future, like about like nursing not being a profession. Like, are we doing this for a good thing or like are we wasting our time? Because I think we should be educated on those things. And also employment opportunities, like Lionel was saying.
Thank you,
Yeah.
Tony. Yeah, I mean, I will say, despite, you know, confusing, chaotic things happening at the federal level, we need nurses. We will always need nurses. So
Right.
please, you are not wasting your time. Um,
No.
yeah,
There
thank
is
you.
a shortage. It's just, there's a shortage of nursing. This policy is just going to make it worse. So you're going to be good, actually, because your salaries might increase. Okay. Having
Yeah.
said that, but it affects people that are trying to keep building on the career pathway. That's all.
Thank you, Sandra. Roy, and then we have to move on.
I just wanted to just say how extremely proud I am of these two young men representing Malcolm X College and trying to expand our efforts to make sure that that the opportunity in healthcare is available to everyone. They're doing a good job. I'm a little worried about next spring because they start their clinical rotations first go around, and as you heard, a lot of them are working regular jobs because our stipends unfortunately aren't able to pay them enough. But let's just keep them in our thoughts and our dreams and good best wishes. Some of them might be rotating at one of your facilities in the near future or the next year and a half of their programs. So please look out for them because these guys are shining stars and destined to do great things. And Lionel and Tony, don't worry, your future is secure. While the concerns around the federal government are concerning as far as the longevity of the profession itself, it really just right now equates to master's and doctoral level degrees in nursing. As our colleague just said, you guys are gonna be just fine for your entry level going in nursing in the beginning of your career. So it's not going anywhere. The world will end if we don't have nurses.
Yes. Thank you so much, Lionel and Tony. Thank you, thank you. Thank you, Darwin.
Thank you. Thank
And
you.
Corey, I know, is there in the room. I look forward to continuing this project with you all and to bringing some real actionable ideas back to this group as to how they can support students. So
Absolutely.
thank you for joining this morning.
Thank you. I look forward to speaking with you all more, and thank you for having us here.
Absolutely. We look forward to hearing from you all too, seeing where you go next. Okay. With that, I'm going to move on to a couple of planning questions for 2026. So get out your phones or oh, why can't I do this? I don't want that. No. I'm going to drop a link in the chat to no, okay. To join our AHA slide. The first question is super easy. I have noticed this year that when we meet in person, sometimes 8:30 is a little too early for those who have kiddos they need to drop off, or you know what, I need to stop sharing and then reshare in order to do this well. So we always meet on a Tuesday morning. We are going to continue to do that. Sometimes twice a year we are virtual and twice a year we are in person. So I am curious, would you like to keep things the same by meeting at 8:30 and ending at 10 a.m.? Do you want to bump it a little bit later, starting at 9 a.m. to 10:30? Or even later, 9:30 to 11 a.m.? Otherwise, things are staying the same. Go ahead, Sandra.
I need to vote on this. So how do I do this? Because 9:30 is better for me.
Were you able to vote?
No.
So there's a QR code on the screen now. You should be able to scan that with your
Let me
phone.
send it. Okay.
And there's also a link in the chat. You can also go directly to ahaslides.com and put in that code UIF2D.
Okay, I got it. Thanks.
Awesome. Okay, and it looks like just bumping it a little bit to 9 a.m. might be our winner. Last call for votes. Excellent. We are changing to 9 to 10:30 a.m. next year. I will send out the dates early in the year, but they will stay on Tuesday mornings. Thank you for your input on that. And then a more meatier question. In 2026, what topics would you like CHWC to convene learning events around? So you should be able to input several answers to this question. Would you like to see us do a workforce summit, but with a different occupation? Youth programs, I see. Would you like us to host an event around any in particular question that you're facing? Should we host some things around these federal changes and how they're impacting us? Internships, higher level changes in healthcare to create system changes. Does whoever put that in want to come off chat and share a little bit more about what you mean?
Come on, April, you know it's me. The policy and advocacy person. I'm just higher level in working in policy and advocacy and working with some of our legislators and working with the healthcare, those decision makers in the healthcare system overall. Maybe at the state level to put in some and some of those recommendations are in the report. So I'm not going to go through them all, but yeah.
Got it. And I am seeing some interest in policies, shift in federal funding and their impact on the workforce. Impacts federal changes, pathways to nursing and opportunities for immigrants. Career pathways for non-clinical roles, workforce retention. Information fair for all programs, a discovery center. Cool idea. Fair chance hiring for those who have been involved in the criminal justice system. That is something I am very interested in as well. And I've been working with the Illinois Department of Public Health to try and figure out how to demystify some of the things around the healthcare worker waiver and the registry. I know I haven't shared that much about that with this group here, but I'm sure I will soon. I have a meeting about it later today. Best practices for partnering with community colleges. We have talked about hosting that. Maybe next year is the time. Okay, last call. Imaging summits. So is that doing the respiratory therapy workforce summit, but with the imaging umbrella, radiography? Is that what that means? If anyone?
Yes.
Awesome.
That was me. Yes.
Thanks, Shonda. Healthcare careers that are inclusive and accessible for individuals with disabilities. Love that. Share information about trends, pathways, and federal impact. Imaging. Okay, last call. We're running a little bit behind time. And I want to get to community announcements and updates. Best practice for increasing clinical slots. Good one. That's a tough nut to crack. Okay, I think I don't see anyone typing, so I am going to open voting. You each can vote on 3 responses of things that really resonated with you, things that are really exciting for you. Got to vote for internships. Got to vote for fair chance hiring. Non-clinical roles. Couple for youth programs. There's lots of votes for fair chance and shifts in federal funding. Ooh, and for best practices in partnering with community colleges. Great. We are putting together our agenda for next year as we speak. We have rescheduled our steering committee retreat to January. So I'm going to bring all these ideas to them in January so we can refine our agenda for next year, and then I will be sharing that back with you. Now, sorry to cut us off here, but I'm going to move us on to some updates from our sister table, the Public Health Workforce Collaborative and the Youth Pathways Committee. Anna Yankolev here from Health and Medicine to share a couple quick updates from them.
Thanks so much, April. Good morning, everybody. Great to see you all here. As April said, my name is Anna Yankolev. I work with the Health and Medicine Policy Research Group, and I facilitate CHWC's sister table, the Public Health Workforce Collaborative, which is focused more on our public health workforce, including community health workers, reproductive health workers like doulas, midwives, behavioral health workers like certified peer support specialists, certified drug and alcohol counselors, EMTs, and folks that work in our many FQHCs and public health community-based organizations. So we have 3 action teams that have been working really hard to advance our goal of making sure that all jobs in the public health sector are good jobs and that they are equitable, accessible, and sustainable. So our supporting workers action team, we conducted a bunch of research on worker-led workforce development strategies that actually help to transform job quality. And I gave a presentation to the Chicago Workforce Funders Alliance last month about different strategies that do that. We have the recording available if anybody is curious. And April, maybe that gets attached to your next newsletter. And we also did a survey of our early career public health professionals to see what their workforce development needs are. For Career Pathways, we likewise participated in the Good Jobs Challenge, had almost 200 folks that we trained and employed through there. And as April mentioned earlier, we are working on this Career Pathways resource, which is a menu to help demystify all of the different career pathways in health, public health, healthcare, and beyond. And we are hoping to have that resource available in early 2026. Thank you so much for your patience, but you all will be some of the first to get your hands on it. And for capacity building, we've been focused on equipping our community-based organizations that have not historically billed Medicaid to help them take advantage of the opportunities that are coming down the pipe for reimbursement for community health workers, for housing-related social needs, for food, for doula and midwifery care. So making sure that we can really help boost up our community capacity to meet the demands that our communities are facing. And if you want to get involved in the PHWC, please email me. I'll drop my email in the chat. We'd love to have you. Next slide. I'm also going to give it an update on our CHWC and PHWC's child committee, the Youth Pathways Committee. This is led by my colleague, Matt McClintock, and he's had a lot of really great progress this year with this space. So if you are an organization that is interested particularly in how to expose, recruit, retain our young people into careers in the health sector, I encourage you to join this committee. We did 2 bus tours to help expose youth to different health professions and health environments. We work with a youth advisory committee to develop content and events that are for youth by youth, including interviewing health practitioners. And there's an upcoming event in just a couple of weeks that is, again, for youth by youth to help give them the lowdown and the 411, whatever term you want to use, on how to navigate the internship space. So what resources are available for them as they're starting their journey in the health sector. So this is, if you know young people, if you work with any organizations that support young people, this is a great opportunity for them to learn more. There's a community of practice that meets a couple of times a year, and working on helping to clarify that workforce ecosystem. So getting all the players lined up, talking to each other, and working together to advance our shared goals. Next slide. We also have an exciting new research project that we are just launching now, and this is really to help understand some of the barriers, the opportunities that are promoting youth access to health career pathways, particularly for kids that have historically not had access to those pathways. And I know we're running short on time, so I'm not going to go into too much detail, but if you want to learn more about this, you can email Matt. I'll drop his email in the chat. And we've got a bunch of upcoming opportunities for you to get involved. And his email's on the chat, on the screen right there. I'll drop it in the chat. And if you want to learn more, reach out to Matt, and I'll give it back to you, April.
Thank you so much, Anna. Yes, to everyone who wants to do things around youth and internships, I definitely highly recommend joining the Youth Pathways Committee. We have our first CHWC event scheduled for January. This is a member spotlight on UI Health's volunteer services program, which they've actually used as a talent pipeline on January 21st. I dropped that in the chat. Does anyone else have something they'd like to share with the group in our last minute or two? Apologies for not leaving more time for the community announcements, but anyone feel free.
This is Brandon again for Reach. Our high school and college paid summer internship application will be coming online in the next week or so. I put the link in the chat. This is roughly a 6-week paid work-based learning experience. The upper high school students and college students actually work out in the units, clinical units or whatever units they're interested in. It was a really great experience. The lower grade high school get more career exploration, but all get certain certifications as well. Thank you.
Amazing. Anyone else have an announcement to share? Well, thank you all so much for joining us for the last quarterly meeting of the year. I look forward to seeing you again next year. You will get all of the dates soon. They'll be in the newsletter. They'll be on our website. I will email everyone a recording of this meeting with the slides tomorrow. Please feel free to reach out to me anytime with suggestions or questions or with an interest in getting involved with something. Thank you, and stay warm out there. Stay dry.
Bye.
Bye. Have a good week.
Take care.
Why can't I end the meeting? Bye, everyone.